Hi, this is Dr. Shanine Sachadina, a breast surgeon here in Orlando, Florida, and the founder of the Central Florida Breast Center and the We Mentor You website. We are launching a campaign for breast cancer awareness. If you feel something, say something. So this is a global campaign where in other parts of the world where women do not have access to mammography, some of the only signs that they will see will actually be lumps or changes in their breast. And so we are advocating for frequent self-breast examinations in order for early detection. So how do you do a self-breast exam? The breast itself is not just the mound that you feel. The breast itself actually goes all the way up to just underneath your collarbone, here to your breastbone, just above your abdomen, and then all the way up into your underneath your arm. Now, when you are checking for your breast for changes, look for any skin changes that you might see. After that, you're going to feel the breast. Take the pads of your fingers and feel every portion of the breast, up and down, in a circular manner, whatever is most comfortable. Make sure you actually squeeze the nipple because you're looking for any kind of discharge, especially if it's bloody.
Self-breast exam. Certainly a lump would be something that you would be checking for. I like the slide that you see before you because it truly speaks to how important it is to get your annual mammogram in your clinical exam. The smallest of the circles is the average size lump found on a mammogram. The largest of the circles is the average size lump found by a woman who doesn't examine her breasts each month. You are also looking for the changes in your breast where they may look a little funny. If you look at the slide, the right breast is larger than the left breast. You will see that the nipple is inverted and the skin is shiny. Those are the things that we would be looking for to have the patient report to us. You're also looking for any kind of indentation in the breast, such as this. Another thing to check for is discharge from your nipple, especially if it's bloody. Though most bloody nipple discharges are benign, meaning not a cancer, there has been associations between bloody nipple discharge and breast cancer as well. Here are some tips about how and when to do a self-breast exam. Always try to do it between day 10 and 15 of your menstrual cycle. If you are in menopause, pick a day, either the beginning of the month, the end of the month, whatever time is more convenient for you, but do it the same day each month. And always use the same exam technique, and I will go over that in a minute. And if you find something, make sure that you seek medical advice. In regard to self-breast exam, I would refer you to the internet as there are some wonderful sites that show you how to do a monthly self-breast exam. But the key points are that you should do it in front of a mirror, standing up, and also laying flat on your bed. This way you will be able to check your breasts in two positions. Always make sure if you're doing a self-breast exam to check the nipple for any discharge, as we have just shown you. Finally, keep a diary of any unusual findings that you may have. You can recheck that area in the months to follow, and if it is still present in the following month, make sure that you seek medical attention. There are many techniques to doing a self-breast exam. You can go up and down on the breast, you can go in a circular fashion, or you can come in from the outside into the central portion, which is the nipple. Whichever technique you're comfortable with, just make sure that you use the same technique each month. Assume that you find something. It is important to seek medical attention from either your primary care doctor, your OBGYN, or a breast surgeon, but not your friends. Though 80% of all the lesions we find are not a cancer and only 20% are, it is important to get professional advice in regard to your changes.
And if you do feel something or see something, then say something because we know early detection improves survival.